About 22,000 women in the U.S. are diagnosed with ovarian cancer each year. 15,000 will die from it. Treating this cancer has typically been a one-size-fits-all approach until now. That's because one woman is trying to change the face of this often deadly disease. Helen Gardner surrounds herself with beautiful art.
This painting, of course, I think is most representational of my life.
Helen's life was uprooted when she was diagnosed with ovarian cancer. She had chemo and surgery, but her cancer came back.
Your life expectancy is less than 5 years.
But Helen wasn't ready to give up. She found the Clarity Foundation, a nonprofit that offers hope for women like her.
80% of people respond to the traditional chemotherapy, but then 80% of us recur.
Founder Dr. Laura Shaver, a cancer researcher and ovarian cancer survivor, says when this cancer recurs, treatment choices aren't clear.
Right now, it's pick out of a hat guesswork as to which one it will be. I just think as a scientist, well, we can do better than that.
The foundation performs molecular profiling. Tumors are sent to labs and analyzed. Patients are then provided treatment suggestions based on their tumor's specific genetic makeup.
We're doing something that I feel the medical community and the insurance community should already be doing.
Helen found a trial testing a drug that matched her tumor's profile. She had a second surgery, and while the future's unknown, she remains hopeful.
I'm getting ready to finish year 4 of those 5 years that they gave me.
So far, the Clarity Foundation has profiled the tumors of almost 300 women. The profiling can cost anywhere from $500 to $5,000. And insurance often covers the expense, but the foundation will help pick up the tab for uninsured patients or those who cannot afford their copay. Now, ovarian cancer kills nearly 3 out of 4 late-stage patients within 5 years, but experts say if it's diagnosed in the earliest stages, it's more than 90% curable. Symptoms that could signal a problem include bloating, heartburn, feeling full quickly, also pelvic pain, and frequent need to urinate. Experts say if any of the following symptoms last longer than 2 weeks, they could be a warning sign, and they include fatigue, upset stomach, back pain, pain during intercourse, and constipation. If you have any of these symptoms, it's best to speak with your doctor. And if you missed any of this information or any of these symptoms, go to delmarvalife.com and click on the show tab, now located on the left side of the home page. Still to come on Delmarva Life, going green to support the environment ahead of Earth Day on Monday. Why you may want to start by looking in your attic. Up next, steps you can take to cut down on your energy costs. And later, it's a seafood lover's delight. We're in the kitchen with Ruth's Chris making crab stuffed rockfish with an Italian seafood sauce. But first, we talked about ovarian cancer. Now let's talk cervical cancer. Dr. Oz has more on the new guidelines.
Hi, I'm Dr. Oz. Are you confused about the new cervical cancer screening guidelines? Women aged 21 to 65 should get a Pap test no more than every 3 years. Age 30 to 65 can go for 5 years if they have an HPV test with the Pap test. Risk factors can alter these guidelines, so it's vital you talk to your doctor.